Okay, so welcome everybody. I just want to thank you all for being here tonight, virtually in your homes and so on, maybe at the library or cafe. Feel very fortunate to start off this series on death and dying and grief and thanatology with Dr. Jana Henning. About to do a quick introduction about her so you have some more detail. So Dr. Henning is a licensed clinical psychologist with over 20 years of experience in providing mental health services for adults with complex trauma, dissociative disorders, chronic and life-threatening illness, and grief and loss-related concerns. She's a professor in the Doctor of Clinical Psychology program at Adler University in Chicago, and the creator and coordinator of its Traumatic Stress Psychology emphasis, which provides training in effective research-informed approaches for clients coping with traumatic stress, death, and dying, life-threatening illness, bereavement, and loss. Dr. Henning earned her doctorate in clinical psych at the Chicago School. She is a fellow in thanatology, death, dying, and bereavement through the Association for Death Education and Counseling, a faculty member for the Portland Institute for Loss and Transition, and the chair of the Education and Training Committee of APA's Division 56, which is trauma psychology. She also provides trauma and loss-focused continuing education, training, and clinical consultation, as well as self-care coaching to prevent and manage vicarious traumatization and burnout for professionals who work with survivors of trauma and loss. Thank you so much for being here, Dr. Henning.
So happy to be here. Thank you.
All right, so I will let you take it away.
So I think you had wanted me maybe to start out talking a little bit about historical contemporary attitudes toward death and grief, maybe some differences in the broad stroke sense between Western and Eastern attitudes and practices, and maybe how that's changed a bit over time. So we might start just even asking, like, why is it worth talking about attitudes toward death, and why do we care about that now? So, one answer to that might be the culture that we're in. It's sort of like the sea we're swimming in, and it shapes how we understand and make sense of the things that happen to us. So the social norms, the structures, the values all around us kind of shape our understanding, and death being one example. What does it mean? What should we do about it? What can we do about it? What should we do about it? And so, this is how we come to understand what death is, through the culture around us. And we're changing, we're developing across our entire lifespan, but also these attitudes evolve historically and over time. So one thing I think is super interesting about it is that it's a two-way process. So we're shaped by the culture around us, but, so we're downloading stuff, but we're also uploading things as we're sort of saying, I don't like that, or that attitude doesn't, fit for me, or that belief doesn't fit for me. And then we do things differently, and we kind of then participate in changing the culture. So the things that socialize us, family, religion, and spirituality, our friends, our family, the events that happen to us around the world, the media now for all of us, those are the things that shape us. But it's kind of a caveat here that if we talk about Western versus Eastern views of things, those are huge lumps. And, we don't want to look at these broad stroke kind of things as a decoder ring. This is how Western people think, this is how Eastern people think, because there's a lot of nuances there. As we know, there's different ethnicities, there are different religious and spiritual traditions that kind of intertwine together. There's intersectionality. And so it is kind of nuanced. But if we want to think about, like in a broad strokes way, Western views about death and dying, we might ask, like, what were the rituals, or what are the rituals that are considered to be appropriate to care for the dead, disposing of the body, to memorialize the loss, what happens after death, what's okay in terms of expressing emotion or not expressing emotion, or what particular kinds of losses mean. And are there particular deaths that are really stigmatized? Like in our culture, for example, suicide, something that there's a lot of maybe shame and stigma around. So talking a little bit, first of all, about how Western culture has changed over time, there was a cultural historian, Philippe Arié, who wrote a book called The Hour of Our Death. And he published this in 1982. And he was like kind of looking at Western culture and saying, hey, you know what, this has changed tremendously over, 1,000+ years. So we think about like where we are now in terms of our attitudes about death. We kind of think things have always been this way and this is the right way to think about things, but it's really changed, remarkably over time. So just to give a few examples, he talked about tame death, for example, as over 1,000 years ago when people lived in these really intimate communities, and death was something they saw all the time. It was part of everyday life. It was really immediate and near to them. And there was this sense that the community needed every member. So if someone died, this was a huge loss. And there were particular things that people had to do about that. So, there were rituals that had to be engaged in. And this was sort of an idea of an ongoing relationship. You owed certain things to the dead. There were certain symbols, that kind of represented how they understood things. There was a sense that the death were physically absent, but were really kind of symbolically still here. And that's how they thought about it. And then as time went on, REA talked about the death of the self. And this was, around about 1500 or so up to that point, where for the first time we're starting to think of ourselves as individuals. And this kind of starts to, do a little preview of how we think about things today. So there was this idea of, these individuals, I am an individual, I'm precious and unique. And there's something really horrible about the idea that this unique and precious individual will die and not be here anymore. And so then there's a lot of horror around this idea of death. And so it kind of got it shrouded in secrecy a bit. Like, that's so horrible to contemplate, I don't even want to think about it. And that's where we started to first, in Western culture, push this to the side and say, you shouldn't talk about these things, you shouldn't consider them. It's also the first time there was this big distinction between the body and the soul. So the idea that the body would die and decay, but the soul would have an afterlife, perhaps in heaven, and that the soul might be judged by God. And so people were thinking about how they're behaving now in terms of later judgment. And then he talked about, in the 1700s, the age of reason, the notion that death is savage because it's not scientific and we can't master it through science. And so that also contributed to this idea of pushing it to the side, hiding it, not thinking about it. It's sort of morbid or upsetting. You don't want to talk about it or think about it. But then it kind of creeps back in the fantasy life, in dreams. It gets almost eroticized a little bit. At the same time, it's getting pushed out of consciousness. Now, the next epoch of death is one that's really interesting to me. And this is what REA called death of the other, which was during the Romantic era. So, the 19th century, and some of you may be a little bit aware, Queen Victoria, who grieved, after her husband's death for the entire rest of her life. And this is like, these ideas are really different from what we think today. So this idea that they held, that the relationships they had, the bonds they had, were so deep and so enduring that it would be considered inappropriate to stop grieving somebody. And so, really, this is only like 150 years ago, where people were thinking it would be entirely appropriate to grieve for the rest of your life, because that not only demonstrated the value of that relationship, the importance of that relationship, but it also said something about you and the depth of your soul. So somebody who got over it, who moved on, would be viewed as a really shallow person. And so when you're mourning and grieving for years and years and years after a death, you're not only demonstrating how important that person was to you, but you're also saying, this is me. This is how deep and soulful I am, that I'm capable of this. So it's really almost in some ways the opposite of how, we've been thinking about things for the last 100 years or so. And, along these lines, people wore elaborate mourning jewelry. Sometimes they would take the hair of the deceased loved one and kind of braid it and twist it and turn it into this beautiful jewelry. And they would wear these rings that had weeping willows on them and, things that would remind them of the reality of death. And so all this went on for quite a while. And then there was a switch around the 1900s or so, and then beyond. There was a feeling of like saturation, almost like enough already. We don't want to hear about it. We don't talk about it too much. World War I, the 1918 and 1919 influenza epidemic and all the deaths. There was this idea like enough already. And so then the pendulum swung back into avoiding, into wanting to not think about it, not talk about it. And, in a lot of respects, medicalizing it. So, people instead of dying at home and in their communities were dying in hospitals. There was an effort to extend life for as long as possible, the quantity of life, not necessarily the quality of life. And, taking away people's control in some sense, because it was the medical profession that took over control. So this idea that, the modernist ideas of science and rationality, and we can beat this thing, we can cure cancer, we're almost there. And, death, once again, being viewed as irrational or something that, mocked the efforts of man to figure out how to resolve these issues and somehow escape death. And so, some of you might, like me, might be old enough to remember Ernest Becker coming out with his book, The Denial of Death, in the 70s, which really looked at how, as a society, we can't face it, we can't think about it, we can't look at it. Because, again, this idea of us as individuals, heroic individuals who achieve and accomplish, and all that gets wiped out by death and is not within our control, which kind of freaks us out. So these modernist ideas about what's efficient, what's rational, also along those lines, people were expected to get over it and not, annoy and inconvenience other people by grieving too much. All these things you can still see today. You might get, if you're lucky, 3 days off of work if a very close loved one dies, because there's this idea that you need to kind of get back to work, move on. You're not going to be excessively emotional. That's considered to be kind of creepy or problematic. You're supposed to sort of detach your emotions from the loved one, move on, move past it. And this was considered for a long time to be healthy, or the healthy way to do it. So, all this went on for quite a long time, but now I think we're in a really interesting period in here, like Western ideas about death, where it's changing. There's maybe, an evolution that's been going on for a little while and picking up speed into this idea of a more postmodern view of death. And some of the things that really highlight that are very related to what we might call Eastern ideas, Buddhist rooted ideas about the self and about death. So there's this kind of like the two are kind of coming together. So some of the things that are happening now is more personalization, more of a desire to have things the way we want to have them. Maybe not, funerals that followed a very particular script, but customized funerals. For example, I received training as a funeral celebrant. So this idea that you might have a unique and personalized kind of memorial after your death that maybe you would even plan before you die. Also, less formality, more informality in our broader culture, more inclusion, more interest in, looking at all of the different individuals in society and how we might be very unique and different from each other. Also, some disillusionment with technology. We don't really trust technology. I mean, we really see that in the last year or two here in the US, especially. Some mistrust of the medical profession, of technology, and more interest in the spiritual, sort of non-technological things, the idea of more control, dying at home. So there's, the rise of green funerals, of, instead of a person choosing to be embalmed in a funeral home, to have a viewing in the home, which some states actually allow and have, rules that you have to follow around how exactly to do that. But there's a really rising interest in bringing it back home, bringing it back to the community. So, some changes, and some of it influenced by Buddhist ideas about the non-permanence of the self, for example. And so this Western idea, at various points in our history is this, the self, myself, the self that I am. And, that's in contrast to the Buddhist idea, for example, of like self is an illusion. What is a self? There is no fixed self. And, so not to get so attached to the self would perhaps free you up a little bit to feel less anxious about what happens after death. that some of the Western idea about fearing death, it's really about losing control. And if you maybe think about a more Eastern or Buddhist influenced way of understanding this, control is an illusion. And if there is any control at all, it might come through releasing, the grasping toward things, and even grasping toward one's understanding of life or the self. And so if this is the case, we might think, the dying have things that they could teach us, because they're having experiences that those who are not dying are not yet having. So can we move toward listening and hearing and being educated by people who are facing those experiences? And part of that might be, not grasping so much on this idea of a fixed self or enduring self, but thinking about death as, kind of a transforming experience that rearranges everything. And again, that's more rooted in an Eastern or Buddhist way of understanding things. So part of the natural cycle of human experience, nothing is permanent. Everything's in motion. So can we, come to acceptance of the life cycle and death, and, let go of our fears and learn some things, and, learn from the dying, think about each person's unique experience. So, that's kind of the essence of where we are right now. And I think it's a fascinating time historically and culturally that the East and West are, coming together and influencing each other so much. So, one thing I think is really of key importance here is this idea of this, the Western idea used to be severing that tie with the dead, and disconnecting from that and moving on. And, partly influenced by Buddhist ideas and partly evolution within the Western ideas. Now we think about a continuing bond. So a person dies, they're not here physically, but the relationship endures. And we might think of it more symbolically, but we think of a living, breathing relationship with someone who isn't physically here anymore. And that feels very comforting to people who are facing death themselves or who are facing the death of a loved one, that relationship goes on and that they can still be connected, just in a different way. So I want to kind of pause here and, take a breath and see, Dom, if you have any follow-up questions, or if you'd like to kind of go on to some of the other questions we talked about.
Yeah, certainly. I think just in relation to, this space. So I recently was reading the Tibetan Book of the Dead, and they sort of talk about this zone, this sort of liminal space called the Bardo, which is basically between living and not existing, and sort of how we all have inhabited that space. Like there's security there. We're part of like some greater whole, but ultimately that's so distant from the way we perceive the world around us, like because we are so used to the sort of like egocentric experience that is living, that is human. And I guess I wonder, through meditation, through mindfulness, I guess like what paths can we sort of take to sort of embrace that a bit more? And have you seen success in treating folks using those sort of techniques, or techniques outside of that?
Yes, so I think that's really interesting. There was a book that came out, you may be familiar with it, a year or two ago, Lincoln in the Bardo. So this idea of Lincoln as a griever, and his so many, his children and people that he loved died. And, this idea of somebody trying to go to the Bardo to reconnect with the loved person who isn't here. And I think that really touches on that idea of the continuing bond, that, it's so difficult for us to let go of that, unless we can think of it as, the bond endures. And so, some of the things I can talk a little bit about in the rest of our time here is how we understand healthy grieving. So when you say how would you approach something like that? Where we are right now is this, sort of really postmodern understanding of things like I was just mentioning, where each person is so unique and so individual in their understanding of their loss and in what they need, that anyone who's working with, people who are grieving or people who are dying, the number one thing I always say is, meet them where they are, be where they are, try to understand what they're struggling with. And then there's different techniques and interventions that we can use to help them move forward with those particular things, which I can touch on a little bit as we go. But for some people, yeah, for some people, it might be mindfulness meditation to help work toward non-attachment or sort of acceptance of what is. And for other people, it might be, what is my understanding of the bardo, or what happens after life, and my understanding of relationships, with people who are no longer here, whether it be death or for some other reason. Sometimes we really grieve these non-death losses too. So listening and asking and trying to understand what is it that this person's struggling with, and how can we help them walk forward, and from the position of a person who also will face death and has also experienced losses. So it's not the separate, you're over here and I'm over here, and I know what's right, and we're going to treat you because there's pathology there, as much as the idea of somebody is grappling with loss, and that is going to be something we're all going to be grappling with if we haven't already. So, I don't know if anyone's seen the series 6 Feet Under. One of my favorite series was on HBO some years ago, about a family who's running a funeral home. And, every episode there were deaths. And the creator, David Ball, I love this quote. He says, "Everybody loses everything." And when you think about it, it's true. So you might either like, oh my God, or you might kind of smile like I am. So, that kind of leads us into another question you and I had talked about, which is, what are healthy ways to engage with fear or anxiety about dying? And that might be for anybody, not necessarily somebody who actually is imminently facing dying, because we're all facing dying. We just don't know exactly when that's going to happen. So, loss, death, this is a fixed part of the human experience. We're embodied. And so, death is going to be something we experience, our loved ones experience. And as we were just kind of talking about, in some parts of Western history, there's this idea of running away, avoiding, trying to hide it. But there's a huge price tag attached to that, because, it's pointless. First of all, it's going to come for you anyway. And I think it's associated with a lot of suffering, a lot of fear, a lot of anxiety that maybe we don't have to feel. So, if we were to turn around, like they always say, you're having a nightmare, something's chasing you, the thing to do is turn around and you'll look at it. What is it? What does it want? So if we can face our own mortality, then, we might open ourselves up for change in positive ways too. Human growth, the ability to be creative and not be, have so much of our energy sucked into avoiding, to actually kind of say, okay, so if this is happening, if it's going to happen, what does that mean for my life today, for who I am and what I want to get done in the time that I have on earth? So, then we might suggest to a client, to each other, to ourselves, can we walk forward instead of running away? Can we stay open? Can we stay curious? Can we just say, what does it feel like? There's a first time for everything. My first time sitting in hospice holding the hand of a dying loved one, there was a first time for that. And, all you can do is walk forward and say, what does this feel like? What am I experiencing now? You might ask yourself, what is it that I'm afraid of? I'm afraid I'm going to leave the earth with unfinished business. Am I afraid, do I have regrets? Am I afraid I'm going to be in pain? These, it'll be helpful to reflect on what actually it is that we're afraid of. And then in the mental health field, we talk a lot about, the cure for avoidance is exposure. So if we're afraid of something, one thing that I suggest my students, my clients, like, watch movies, watch TV shows about death, and just kind of expose yourself to it and let yourself feel what you feel, so that you have your full range of motion, as I like to say. You're not constricting and running away and hiding and avoiding something, but you can actually feel and hang in there, with the challenging experiences of life. So, that kind of leads to another question we had talked about, and that's like, how do you talk about mortality with, either a loved one, somebody with cancer, like how do you even engage in those conversations? So I think there's kind of two ways to look at that. One is, if you're the person who you yourself are facing death, how do you think about mortality versus how do you think about it with a person that you love? So, it can be challenging if you yourself are on this path and you've had you've gotten a diagnosis, maybe with a shorter prognosis. This is something that I've had some experience with as a therapist, but also as a person. Last year, I received a terminal diagnosis myself. It turns out it was mistaken, but for a period of time, I thought I had very little time left. And so I was really observing, okay, what is this like? I've done this work as a therapist. What is it like as a person? What do I want? What am I feeling? I try to stay open and be very curious. And one thing that comes out of both my clinical work and my own experience is, seek the support that you feel will be helpful for you. So if you have a health condition, seek out information. If you want to talk about things, find somebody who will let you just talk and vent. So, a lot of times there are people who mean well, but try to cheer a person up, look on the bright side. I'm sure you're going to be fine. That may or may not be realistic. And so the person who's going through this is hearing it and feeling like, I can't talk to you. I can't tell you what I really feel because, the other person's agenda is, I can't go there. I can't think about it. It's too painful for me. And so they're trying to cheer up the person facing death. When really what that person often wants is someone who just listen, who will just be present with them and let them say, whatever they're feeling, let them describe whatever they're feeling or thinking. And sometimes the family thinks, okay, that means you're giving up and we can't let you give up. But a lot of times a person is just trying to make sense of things and needs to talk it through. And, maybe they don't even know how they feel till they have a chance to, talk it through with someone who can be a sounding board. And another piece of it is, there might be things that someone wants to do in the time that they have left, like say goodbye or resolve some unfinished business. And if they don't have the space to do that, then, that actually keeps them from getting to the peace of mind that they need. So I want to pause here and not just be talking and see if, at any point you have follow-up questions or comments.
Of course. I always do. So just to sort of follow up with what you just said, I think we often feel the need to protect others and ourselves simultaneously, but there's constantly this fear that if we are to bring up death, we'll sound macabre or we'll sound like the downer in the room, and we don't want to bring down the energy or the vibe or what have you, because I feel like we're very stuck on trying to maintain positivity. And so I've been reading a little bit more about what toxic positivity is, these people who come in the room and they're like, okay, let's keep it all fun and great all the time. And so I guess I sort of wonder, as we search for balance in sort of navigating these spaces between negotiating or trying to understand and deepen our connection with our mortality, but also trying to broaden our connection to others who are close to us by having some degree of understanding between us. I suppose, like, how can we sort of engage? And I know you've answered this as far as like being open, being sure that we can do it with safe members within our communities, but how do we sort of soften that fear that we will upset others or upset ourselves, and sort of tread lightly, but not too lightly?
Yeah. So, and again, I think there's a lot of variation from person to person, but I know what I can speak to from my own clinical work and my own experience last year is this idea of staying in the middle. So not avoiding, not denying, not running away from something, but not getting so immersed or pulled underneath the surface of despair and terror. So can you stay in the middle and seek information and kind of let yourself go there or think about something, and then also kind of pull out of it a little bit and say, okay, now I need to do the dishes or cook some dinner or take a walk or whatever, and try to stay in that middle place. Because we know, like Jamie Pennebaker did a ton of research on expressive journaling, to help people express emotions that they're feeling, because according to his research, it actually hurt the immune system to repress and suppress and stuff down these feelings. So one of the real downsides of trying to, like, positive, you mentioned toxic positivity. Also, Jimmy Holland, who was one of the first like psycho-oncologists, she talked about the tyranny of the positive, that well-meaning folks will come in and say you have to have a positive attitude and look at the bread, and then that feels like yet another chore or task, because sometimes people just don't feel that and they want to feel what they feel, and then they can maybe kind of talk it through and shift it into a better place, at least for today. But this constant pressure, never to be a downer, Debbie Downer, or talk about things that other people don't want to hear, that actually puts a lot of pressure on the person. And so trying to be in that middle space, where you might be with the person where they are and allow them to say what they say, and then be that sounding board where sometimes people kind of talk themselves out of that, this is what I'm feeling, I'm afraid, I don't know what's going to happen next. And then because they're able to listen to somebody who really cares, they kind of start narrating themselves into, well, I can do this and I need to do this, because they had somebody who could truly listen and wasn't trying to kind of taser them down into a direction that felt, more comfortable for the listener. But there's also really practical things that people can do to support someone facing that. And that might be like, not just say, let me know if there's anything you need, because we know that, the person's never going to tell you that, it's too vague. There, you're putting the pressure on them. Whereas a loved one might say something like, when can I come over and bring you dinner? Or what night can I come over and help you wash the dishes or vacuum or whatever? And, I want you to know I'm here to listen to you. You can tell me anything. You don't have to edit yourself with me. What's a good night for us to have a phone call? And so to be a little more specific and a little more assertive like that, and it just makes all the difference for people who have a chronic illness, a life-threatening illness, who are facing this, to not have to feel so alone. And, to think about, and I think it's a wonderful question, like, what would we say or not say to a loved one who's, facing this kind of thing? And, this was a question that you had suggested we might talk about. I think it's a wonderful question. I had two wonderful friends in the last couple of years who asked me, as somebody who does this work, they both had a very close loved one who's dying, and they both asked me, tell me what I should say. Help me be a better friend or a better son. It almost brings tears to my eyes, like remembering this, that they said, who should I be? What should I say to be of most help to this person? And, that's what, any one of us can kind of invite ourselves to think about in preparation, because if we don't have somebody in our lives who's facing this now, we will. So who do we want to be in the context of this? And I would say, first and foremost, just be there. Express love. Tell them that you care about them. Tell them they matter to you. Listen. All of that, like, first and foremost, your presence. But, then also maybe from a practical perspective, like we were just talking about, what do they need help with? What do they want to focus on or think about? And there's a lot of tasks. If you're really thinking, you're in it and you have to face end of life, there's some plans that you have to make and some tasks that you have to engage in, some real practical stuff, but also maybe resolving unfinished business, or, things, that you've regretted. Is there any way to shift your life in the time that you have left? Like, what do you want to do in the time that you have left? How do you want to spend it? And it's so wonderful to have a person who can kind of listen to you and brainstorm with you through all that, so that you don't really have to do it entirely alone. So I think, it's a wonderful question for us to think about who we want to be for others, and also how we're going to want to be when we get to that point ourselves.
Certainly. Okay, I've got one more question for you.
Yeah.
Or at least one more. So Now, one thing I've sort of noticed, particularly with young adults, there's a degree of disillusionment, right? And in late stage capitalism, whatever you want to call it, things start to feel as though they aren't quite as significant for some. And so this leads to feelings of ambivalence or nihilism or adopting these sorts of philosophies. And so for these folks who sort of tread there, losing interest in living, knowing that there's this sort of futility hanging over them, I guess, like, how would we motivate them to continue to persevere? And I'm not going to say stay positive, but I guess, how would we either motivate them, whether that's for us, whether that's for a friend or a family member? I guess, how do we sort of deal with nihilism or ambivalence when it sort of comes up for us?
Well, and again, what I've been talking about really applies here. The notion that, you know, they're shaped by the things that are happening in the world. We're all shaped by things that are happening in the world right now. And yet we each are reacting to it in our unique and personal ways, based on who we are, where we came from, what our values are, what our beliefs are. And so I wouldn't say there's a one size fits all answer to that, but I would say there's questions I would ask somebody like that. And I would, for example, they talk a little bit about the assumptive world and meaning making as being really key in grief and loss nowadays. And so this idea that you had a roadmap about how things were going to go, you thought they were going to go in a particular way. I can say as person who's exiting, late middle adulthood and entering older adulthood, I sort of thought things were going to go a particular way in terms of democracy, in terms of, physical safety. I didn't realize that a, 100-year pandemic was going to, come around. But of course, if you think about it, it's only logical. But, all these things have really changed how we understand the world. And I had a roadmap of how I thought things were going to go. And then these things happened and they blew up the map. And so then what helps people move forward is a new map. And that might mean, okay, so what is the world and where are we going? And who am I in the context of all of that? And maybe I had goals or values and things I was moving toward, but those are not going to make any sense anymore. So what does make sense? What's left? What remains? And where do I want to develop myself, and where do I want to put my efforts and energy? So one of the things that's emerging as really, powerful for people, when we talk about burnout, vicarious traumatization in the mental health field, they used to think, oh, get a massage, take a vacation, all these like sort of superficial things. But that hasn't actually turned out to be helpful. What's more helpful is meaning and purpose. And so for anybody who's feeling, the sort of nihilism and the whole thing's going to shit, is there anything left? Is there anything that remains? Is there anything of meaning? Does it make any sense for you to try to work towards something better, or try to help people who have been harmed maybe in the same ways you've been harmed? And so I would be asking a lot of questions about each person's experience, and then inviting them to think about, how did they think things were going to go? And, how did it turn out? And what part of the map got blown up and no longer makes sense? And is there a way to kind of recreate the map for the new world and for the new way things are going? And what parts of you will remain the same and what parts of you will change? So, for each person, the answers to those questions are going to be different. But it's whether a person's facing those kinds of non-death losses or facing end of life of themselves or a loved one, it's kind of the same thing. How did I think things were going to go? How did they actually go? And what's left? What remains? And those are, I think, fascinating questions that every person's going to answer in a different way.
Certainly. And got one more question, and then I think we'll open it up to our guests. And so this is a question I've come in contact with quite often is how long is too long to grieve? I think we often want to put a timeline on when we'll feel better, whether that has to do with getting back to our normal life or just being able to see what normal is again. And Lord knows we're all familiar with the phrase new normal thanks to the pandemic. But I guess like as we look at adaptation, and as we look at like timelines, once again, how would you sort of respond to that?
Yeah, I mean, there's a couple of things I would say in response to that. And one is kind of like what's the normal trajectory for grieving? So, if you're looking at a capitalist society, it's like, well, you should be over that in like 2 or 3 days and then like get back at it again, get back to work. But actually there's some different kind of patterns of responding. So for some people, they might feel some distress, immediately after a loss, and then kind of get back to normal pretty quickly. And that might have to do with the nature of the loss. It might have to do with the person's own personality. There's a lot going on there. And then for some people, they might feel a lot of distress, maybe when we look at timelines, people usually like distress kind of increases up to about 3 months because that's when everyone peels off and like, okay, you're back to normal now. I don't know, need to bring the casseroles over or ask you how you're doing. And that's when the reality kind of sinks in, like, oh my God, this person's really not coming back. But then they might start to feel a little bit better. Distress goes down, and then the anniversary date, 1 year, comes around, and then there's an increase in distress, and then it kind of goes down again, and then maybe another increase at 2 years. So it's like a year for a lot of people is not unusual. And then for some people, they're going to have a high level of distress and it's going to stay high and it's never really going to go down. And so, how to respond or what's helpful is going to vary depending on, who that person is. So if you're a person who felt, a little bit of distress in the beginning, but it kind of quickly went down, they're not going to tend to need a lot of assistance. It's like Robert Niemeyer said, like childbirth, grieving is painful, but not fatal. Like, most people can kind of handle it on their own. And then, you go on. If you are a person who is experiencing some distress and then it kind of goes down over time, you might say that's kind of the natural course of grieving. You might ask the person, do you need help? Would you like help? Would you like to talk about it? But it's the ones with the higher level of distress that never really go down that we might be a little bit more worried about. And, we even have now a diagnosis in the DSM-5 TR, prolonged grief disorder, which is really much more about people who, a year, 2 years, beyond, maybe 10 years more, they're really feeling a really high level of distress. And those are the people who may really benefit from some services. There might even be a relationship between depression and prolonged grief disorder. And what we're really looking at here is people who are struggling with activities of daily living, we're having a hard time eating, sleeping, taking care of themselves, who might experience suicidality themselves, other than kind of a passing comment like, I can't wait to be in heaven so I can see Johnny again. I wouldn't be concerned about that, but I would be concerned about somebody who's thinking about how to make that happen. Or somebody who just almost feels like they're reliving the loss over and over and over and over again, and they never seem to kind of move past that, or they feel only painful memories and they can't remember the good times with the person. And so that's where we might be talking about prolonged grief disorder and something that's a little bit more of a focus of attention. So again, there's no one cookie cutter type answer. It's really where this person is and how they're working with it in their lives. So to give you one example, my mom and stepfather had been married for many years, over 30 years, and he was ill for a long time and he died. And about 2 weeks later, my mom and I were out having breakfast, and I made some comment like, well, if Frank were here, he would have done this. And my mom started to cry. But then I said, and he probably also would have said this, and she started to laugh. And then, we kind of remembered it and there was moments, and then she kind of shifted on, because we were getting ready to do one of our favorite things, which is go visit a cemetery, because we're like really into cemeteries and we enjoy walking around and looking at things and talking about it. And so she was able to like grieve and feel that pain, but also kind of laugh and remember a humorous memory of him. And then also get back to eating her breakfast. And then, we went out to the cemetery. So the sadness is there, but there's a flexibility to it. The person can also access positive memories, can kind of accept comfort and feel comforted, as opposed to a person who's like, they're angry, they're in the grief, and it's very hard for them to shift out of it or to have a flexible response or reaction. So, I don't think there's just one right answer as to how long it takes to grieve anymore. It varies a bit, but I think we might start to get a little concerned, when it's getting beyond a year and 2 years and the person feels like they're still very stuck in place. So did that answer the question?
Certainly. And my only follow-up question to that is, for those who do experience that more long-term grief, what are the general interventions, and what sort of treatment can they expect?
Yeah, so just kind of briefly, it's often the treatment approach borrows quite a bit from treatment for PTSD, because often there's like this event story, as they call it, where something about the nature of the loss felt almost like traumatizing to them. And sometimes it is traumatizing, because we see it a little bit more often when there's something really kind of awful or horrific about the loss. It was unexpected, like out of the normal lifespan, like a child, or there's a terrible accident, or there's human wrongdoing, or there was something about that relationship that was so intense that that person has no other relationship like that in their life. And so the treatments, and there are a lot of people now trained to treat prolonged grief disorder, often the treatments have an exposure component, meaning you're having the person tell the story of the loss, and you're sort of exposing them to that story, and then often audio recording or videotaping it, having the person rewatch the video, listen to the audio recording, and then talking to them about what they're experiencing, what they're telling, what they're observing about themselves telling it. So they're exposing themselves to the narrative and then they're retelling it. And often there's a huge difference over time when you do that in the way they tell the story, whether they tell it like they're in it and they're immersed in it right this minute, or whether they can kind of put it in the context of the overall story of their life. And then often there's like some work around resolving unfinished business that may exist with the deceased person. So through empty chair, through letter writing techniques where the person can express their feelings about some unfinished business, and then often get a shift in perspective, like you do with empty chair, where then you're in the other chair and you're talking back to you in the voice of the person who's no longer here. And often there can be a shift in perspective about that relationship, or working on that continuing bond, ways to strengthen that symbolic relationship so that you don't feel they're gone forever, because they're still in your heart and in your soul. And so often the treatments that are being used now are pulling those types of interventions.
Okay, thank you so much. And I want to leave some room here. We've got about 9 minutes for any questions that our guests may have. If you do have any questions, please just go ahead and type them up and send them in the chat. And if you don't know how to do that, there is an option to send like a thumbs up in the reactions, or raise a hand, and we can try and help you as best as we can. I feel like some smooth jazz would be wonderful right now. All right. So Tracy, do you have a question? I see. Okay, got you. Got you. Just showing us your lovely faces. Excellent. Hey there. So if we don't have any questions, I have one more question, and that's about survivor's guilt. So for those of us who are left behind or who continue on, how do we sort of deal with feelings of it should have been me, or just feeling guilty after someone has passed away?
Yeah, so again, I think it can be really helpful to resolve some of this unfinished business because it may be that there's a feeling that you should have done something or shouldn't have done something. And so, to kind of express that in a letter that you would write to the person or an empty chair or something that allows you to express how you feel about, what happened and open it up to that perspective shift. So in a 3-letter technique that Michael Mahoney developed, the first letter is, you write to the person and you express all the things that you're feeling, about whatever it was that happened between the two of you. And then the second letter, so that the same person writes the second letter as if they were writing for the other person. And this would be the letter that you think they would realistically write you. So if we're using this like unfinished business around a person who died, like a parent, and it was a kind of an abusive relationship, first you'd write the letter expressing everything that you feel about, what happened. And then the second letter would be the parent writing the letter back to you, but it'd be like a realistic letter, what you realistically think they would say. But the third letter is where the action is. And the third letter is, again, you are writing the letter from the deceased person, but from that person's highest human qualities. So, what is the letter in a sense you would long to receive from that person? So it's kind of like empty chair, because first you're expressing it through the letter, and then the second letter is they're talking back to you. But then the third letter is, what would you long to receive? And so if you were doing that in the context of survivor's guilt, your first letter might be, this is how I feel, and this is what I wish I'd done, and I'm so upset with myself, or whatever it is. The second letter might be, yeah, you're right, you should have done those things. It's sort of like very realistic, like how you're afraid they would respond. But that third letter would be, I love you. I never, would think about that for an instant. I was just so happy to, we had each other. It's the letter that you want to receive in some ways. Or if you're doing that using empty chair, it's a little bit more spontaneous and organic. And sometimes you don't even know, if you're the one in those chairs, what's going to come out of your mouth. But that's where the perspective switch really happens, where something you weren't even thinking about comes out of your mouth when you're sitting in that other chair. And so there's those types of experiential interventions that are about perspective shifts, can help shake loose that feeling of, I am to blame, I'm on the hook for something I did or should have done. And then often allowing you to see it from another point of view. And it's easier to do it in those experiential interventions than just kind of, do it through narrative in a therapy session. Because there's that stuff that's kind of pushed down. We're like, we're not ready to go there. We're holding on to a way of thinking about it. And it's often through those experiential perspective shift types of interventions that it gets shaken loose a bit.
Okay, thank you so much. Now I see a hand up. Does that mean there's a question, or are you saying hi? A question. Okay, excellent.